Welcome to another edition of Politics Done Right. Today I am with Laura Packard. This is our second interview because we want to talk on a different subject, and this is a subject of healthcare. Laura, I was listening into one of your previous interviews, and I heard a personal story about your healthcare situation that I wanted to go through because I believe that the more people learn about what can happen to us in our healthcare, the more they'll be more empathetic and the more they'll demand more from their politicians. Tell me your story.
Sure. Well, in 2017, I was diagnosed with stage 4 cancer, and this was the spring of 2017. So, this was while Republicans in Congress under President Trump were trying to repeal the Affordable Care Act, which was keeping me alive. So, I was very invested in that fight. I would go get chemotherapy in the morning and then go protest in the afternoon because my life was on the line. So thankfully, they did not succeed in dismantling the Affordable Care
McCain
Act.
and the fingers down, yeah.
But it was that close. I mean,
Right.
it came down to one vote in the Senate. And I'm lucky to be in remission today, but I'm going to be a cancer survivor for the rest of my life. And if insurance companies have the opportunity, they would rather not give me health insurance. So if they ever have the choice again to pick and choose who they cover, they would not cover me. And I can't go without health insurance because I don't know what happens next.
This is important because I think a lot of people don't understand it. Because you just said it, there's this thing called pre-existing condition. You now officially have a serious pre-existing condition. And under a Trump presidency who wants to give control back to insurance companies, what would happen? What does that actually mean?
Well, they make more money if they only cover healthy people who have never had anything bad ever happen to them. So that means no car accidents, no strokes, no cancer, no heart disease, no lung disease. So if they have the choice, they will cancel your insurance if anything bad ever happens to you, and they'll never cover you again.
Right.
So we can't go back to that. I mean, I'm self-employed, and I used to have a junk insurance policy. If I had gotten sick while I had that policy, they would not have covered the care that I needed, and today I would be bankrupt or dead.
Actually, I think you would have been bankrupt then dead. It's sad that the rich country that we live in, we still to date don't have universal health care. What are you trying to do in that regards? Are you working towards working with other organizations to finally get us to whether you want to call it Medicare for all, healthcare for all, or whatever?
Well, I serve as executive director of Healthcare Voter. And so we're informing voters about what's at stake and letting people know how your elected officials have voted on your healthcare. Unfortunately, as you know, we don't have the votes today to expand healthcare. I mean, we don't have the votes today to preserve the healthcare we have. The Right to Contraception Act lost in the Senate last month. So right now, there just aren't the votes to get to healthcare for everybody. But that's why it's so important to pay attention to how your elected officials are voting. And if they don't support your health care, you have the chance to do something about it.
Absolutely. Most of the people supporting healthcare for all, to put it bluntly, and I don't want to be partisan, but they are Democratic. Most of not all Democrats support healthcare for all, but we know that the progressive Democrats support healthcare for all. It's almost that is the nature of it. Don't you think that because of the pathway Republicans have laid with the type of regressive policies they support, don't you really think that November should really be a landslide for those who support policies for people?
I would hope so, but I think a lot of people don't. It's hard to get good news these days. Newspapers have folded, have reduced reporters, reduced quality reporting. TV is kind of a mess. Social media isn't any better necessarily. So, there are news deserts in this country, just like there's grocery deserts, place where there is no good local grocery store. So I think that if everybody voted and everybody was an informed voter, then yes, Americans by and large think that everybody should have health care.
Right.
But there's a disconnect in the information people are receiving. And I think also, if you don't have good sources of news, you don't necessarily know how your elected officials are
Right.
voting. And then you may feel like you can't make an informed vote, and maybe you don't vote at all, or you vote how you've done in the past, or what friends and neighbors suggest. So it's important to actually hold people accountable for the votes they make, not just the words that they say. And it's important to get out there and vote. But I wish we lived in a country where everybody voted.
You know what is interesting? It always behooved me, but I hear people say all the times when we talk about healthcare for all or universal healthcare, we can't afford it. And then my answer to them is, are you telling me that if we can't afford it, are you saying those people who can afford healthcare get to live and those who can't get to die? Is that what we're saying? And the reality is we definitely can afford it. We just don't, we just allow ourselves to be hoodwinked by those who don't want to pay for it. What's your thoughts?
Yeah, I mean, it's all about choices. We choose who to tax and how much we tax them. And there are billionaires that are paying lower rates than their secretaries. And that's a choice. That's a policy choice. And if we made different choices, if we had a fairer tax system and people who are doing well paid more of their fair share, we would have the resources we need to make sure that everybody in this country has the health care they need. I don't believe that all the other first world countries have somehow figured out some magic solution that we haven't. I mean, everybody's healthcare system looks a little different, but they've all gotten to the place where almost everybody gets affordable healthcare. And we haven't done that. And I think that is a lack of will.
We've done that by choice. And it's time. But you know what, Laura, with the work that you're doing and the work that we are doing here, trying to make sure that your message gets out, I think the idea is to solve that information desert problem by going directly to the people where we can reach them. And just hope that you continue doing what you do and these organizations continue doing what they're doing so that we can finally get to the right place. And I think we will. And with your work, Laura Packard, thank you so kindly for speaking to me on this issue.
Thanks.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.